805-944-0000 or visit sonrisasclinic.com. Afraid of needles? Anxious about going under the knife? Do the words invasive surgery make you queasy to think about? After years of being mistaken for someone in her 20s, Alicia Couri, a mom of 3 in her late 40s, finally got tired of hearing, "You should write a book about why you look so young." Anxious so about that's exactly what she did. In her book, Age Younger, 21 Tips to Make Your 40s Look Like Your 20s, after she outlines 21 of her top tips for looking and feeling decades younger. These tips can easily be implemented into your own lifestyle about why you look so young. Make your 40s look like your 20s. Go to acradio.live to order your copy today. Hi, I'm Alicia Couri, and you know me from my radio show, Unleash Your Audacious Confidence with Alicia Couri. If you lack confidence and boldness to really go out there and conquer the world, I'm here to share this valuable resource. In my book, Your Signature Style, Unlocking the Confidence, Style, and Influence of the Savvy CEO, I'll take you through a process where you can release your fears and embrace your femininity as a powerful tool to unleash your audacious confidence and win. This is where it all began for me, and I want to share it with you. Get your copy today at acradio.live. Bring out your beauty and confidence from the inside out. Buy this book today at www.acradio.live.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Hi, I'm Alicia Couri, and I'm here to influence, educate, inspire, and entertain you with audacious confidence. Audacious confidence is the unshakable belief in yourself that's so bold and so daring that you live your life without limits or restrictions. So join me on my show, Unleash Your Audacious Confidence, so we can discover the unknown you. Call in to join the conversation at 888-565-1470. Let's get started. Hey everyone, happy Monday. It's Monday again. Welcome to Unleash Your Audacious Confidence with me, Alicia Couri. Woohoo! And I have an amazing guest in the studio with me today. But before I get started, there are a couple things I do want to say. First of all, if you're watching on Facebook Live, make sure to invite everyone you know to join in and watch. You know, sharing is caring, so make sure you invite, because that's what I'm doing right now. I'm personally inviting all of you to tune in and watch on Facebook Live. And if you are on Periscope, swipe and share. Swipe and share if you're listening to us on Periscope, so that you can also invite people, your group, to watch us live here on the radio. That sounds funny, right? Watch us live on the radio. Well, yeah, that's what we're doing. We're watching us live on the radio. So I just want to thank my sponsors. My sponsors this month are Brinker Education Initiative with Mary Ellen Brinker, Jane L. Robinson, as well as Dr. Waich, who is here with me today from Sonrisas Dental Clinic.
Thank
you.
I
have Dr. Waich with me. Why does my hair look crazy? My hair looks so crazy
Fancy,
today.
fancy.
Yeah. I'm all discombobulated. Okay, let me get reset. So, I'm just going to tell you a little bit about Dr. Waich before we bring her on. Oh, she's already on. There you go. What? Dr. Viviana Waich, with more than 15 years of excellence and expertise in dentistry, Dr. Viviana L. Waich continues to provide the finest dental care and techniques to her patients in a relaxed and caring environment in North Miami Beach, Florida. And she happens to be my dentist as well. Dr. Waich received her doctorate in dental medicine from Santa Maria University in 2002 in Caracas, Venezuela. And in 2005, she moved to Colombia and completed her master's in oral surgery and pathology at the,
University Javeriana of Colombia.
There we go. I'm not even going to try. And then she was accepted in the oral and
facial surgery at Jackson Memorial
Hospital in 2007, and also at the General Dentistry Program in Lindsay Hopkins Community Smiles Dental Research Clinic in 2008, and went on to private practice in Miami, Florida. She's focused on providing expert, conservative general and wellness dentistry, and is committed to making even the most anxious patient at ease. And I am so honored to welcome Dr. Viviana Waich to the show.
Thank you very much. Thank you.
You're very welcome. Now, to get the ball rolling, because this is all about confidence, and we know confidence, your smile has a direct link to confidence and how you feel about yourself, how you look to others. And so the first kickoff question, I know she answered this the last time she was here, but why dentistry?
Well, the smile is the soul of your, how do you say, the entrance of your soul.
Yeah.
Everything goes right there. If you see in the mirror in the morning and you smile and it's an ugly smile, the last thing you're going to be, it's confident.
Right.
So first I recommend you to go to the hair salon and then go to the dentist. If your hair is not straight or properly curled, you're going to be devastated as a woman. If you are a man, well, probably you didn't care.
Get a little
but if
gel
you
and
smile and you have ugly teeth, you're missing teeth, definitely you're not going to smile. You're going to be depressed all day. So smile is very important. It's not just
very important.
And important for your health too, because if you don't eat, you don't have the proper diet, you cannot chew your food, everything is pain. It's like having a bad shoe. If it's tight and hurt, you won't be able to walk the whole day. The same thing with your mouth.
It's very important for your overall health. Because when your teeth hurt, when you have a toothache and you can't eat, or you have a blister and you can't eat, it affects how you eat and what you eat, and you're not nourishing your body correctly. So everything starts right in here.
Excellent.
Everything starts right in here. So we're going to dive deep into the mouth today and talk a lot about things that you can do cosmetically, as well as to make yourself look and feel better, but also to improve your health. So the first question I'm going to ask about, we're going to talk about implants. Dental implants, because when you're missing teeth, again, it affects your confidence. If your teeth fall out, if they've been knocked out, and long ago, there weren't really great solutions for people who were missing teeth, so they just went around without, teeth.
Usually, if you miss a tooth or you lose a tooth, the dentist come, yank it out, there's no more teeth. Then maybe if you can afford something expensive, you may get a bridge or a crown. And if you cannot afford it, you will get a partial denture, which is something that you put it in and you put it out. And if you blow your nose, that thing can come out of your mouth.
You can't bite into an apple or nothing.
Not really. That thing's going to stay in the apple for sure.
Right.
But not recently, but in the couple of years, little by little has been more affordable and more accessible to everybody. We have the dental implants. So it's very important that when you go to a dentist to pull out your teeth, not just take the teeth out, but you need to get the advice from the dentist that you need to put a bone graft in the tooth.
Right.
What that means is that the tooth is sitting in something called the socket, in the bone. Once you pull the tooth out, there is a hole. If you don't put anything in the hole is going to shrink by 30-40%. So if you put a bone graft, which is just a simple powder that you put in place, you put maybe a little piece of collagen on top and you suture that, the bone's going to be stable for a couple of years.
Wow.
Of course.
And something so simple.
It is simple, it's not expensive, and you're going to have a good solution. And even if you don't going to put an implant, sometimes people put bridges and they have this piece of tissue that
like
it's concave. Correct,
right.
That's the word. It's concave, and the food stays in there. So getting a bone graft after an extraction, it has to be a mandatory thing. That's what I think. Because you need to preserve the bone as it is. If you have, for example, if you wait too long and your tooth is wiggling and it's moving and you don't do anything about it, and you get this blister that goes and come, and it actually doesn't hurt. Even when the teeth are very movable, people, they don't have pain. They don't do anything. They just wait until the last minute to buy the apple and take
until the tooth comes
apple.
out with the apple, right?
So the longer you wait, the less bone you're going to have, and the less chances and possibility to even put a bone graft or even put an implant in the future.
So don't avoid it. If you have a shaky tooth, or if you've had, a tooth fall out, go immediately to the dentist so they can preserve that bone.
As much bone as you have,
as possible.
The best results you're going to have in the future, especially in the front area.
Yeah.
Because that aesthetic part is so difficult to achieve when you wait so long and get that concave, how do you say it?
Yes, the concave, when you have that.
Correct, concave area in that section, and they don't going to look aesthetically appropriate.
And like you said, you can get food particles trapped in there, and
Correct.
and that's not pretty.
So that's the first step to getting an implant.
Okay, the first step to getting an implant, if you lose a tooth, is to get a bone graft.
Correct.
Until you can get the implant, or that helps to stabilize the implant?
No, it's like having a field. You have a field full of trees. Then you take all the trees out and it rains. What happened with the grass? It will shrink down.
Right.
If you take the tree and you put grass on top, the field's going to look the same. So that's what we want. We want the same field, so we're going to be able to put the screw inside the jaw.
Inside of it.
So it sounds
that's
horrible.
Your first step.
But
it's an important step.
It's a very simple procedure, I have to say.
Okay. So you get the bone graft done. If you're missing a tooth, if your tooth is wiggly and it's coming out, you need to go get Do they do bone grafts for wisdom teeth or no?
No.
That you just take that out and...
You shouldn't. If you get a bone graft, in my personal opinion, if you get a bone graft in a wisdom teeth, run away from that dentist.
It doesn't make sense.
Well, if they took the tooth out and you have a huge defect that it will look really bad, I may think about it. In my 20 years of experience, I have never bone grafted a wisdom teeth.
From wisdom teeth.
I have to say I'm an oral surgeon from another country, and I do very cautious extractions, and I don't gonna break the jaw, but I don't think it's necessary.
Okay. So only like towards the front if you have...
a tooth that is going to be replaced by an implant, correct.
Tooth. All right. So we talked a little bit about implants. Now let's look at once you do the bone graft, you got to get the screw in, because right now that's the situation that we're dealing with my 15-year-old, is that she has to have implants because she's missing teeth.
Correct.
Her baby teeth. Well, you know her baby teeth were there, but the permanent teeth weren't there.
Correct.
So she has to get...
So to get an idea what happened with her is that she got braces. They were opening the space for the teeth that she didn't have.
Right.
And now she have the space ready to get the implant in place.
Right.
So the next step is to put the screw inside the bone. Again, it sounds horrible and sounds like a crazy surgery. But even I got an implant. I lost a tooth. It's horrible to say, but I was a bad kid. I eat all the candy I saw in my ward. I didn't brush my teeth like anybody. I didn't want to be a dentist forever. So I had to go through the same thing. And I have to say, as a personal experience, pulling the teeth out was much more horrible than putting the implant there.
The implant in. Well, yeah, she didn't have to pull the teeth out because she just didn't have them.
Correct. So it's a very straightforward procedure. It's between 30 minutes to an hour to finish, between the beginning, at the end. You put an x-ray to see that you're guiding and you're going in the right place. And also you get x-rays at the end to be sure you put it in the right place. And you suture again, and you have two options. You can do an immediate implant, which means that you pull the tooth out and you put the implant right away. Depends on the quality of the bone around. Or in your daughter's case, they're going to put the implant and we suture again, and they're going to put the temporary thing that she's wearing right now.
Until her jaw is completely grown.
Mature,
because it has to be matured. So that was one of the other things about age, the age of a child.
The age is important because you're not going to put in a 13 years old, you're not going to put an implant. You have to wait until he grows properly. Meanwhile, he's going to wear something temporary. He can wear a bridge, like a flipper, we call it, which is a little piece of fake tooth with a plastic around that you put it in and you put it out until you're fully grown. Because if you put an implant and then you keep growing, it's going to look unproportioned with the rest of the teeth.
Right. Because kids now with sports and everything, they may lose a tooth during...
Sport injury, man, it's one of the number one.
Yeah, and it's not like we said the last time, if the tooth falls out, push it back in. If the tooth falls out and you've lost it, they have to get an implant.
But you
have
still,
to wait.
I have to make a point in there. If you lose the tooth and you put it back again, like we explained the last time, sometimes it works. You just need to get a root canal in the tooth and you can keep your tooth. But those are the cases that the parents already are prepared, and it's like CPR. You already know what to do. The tooth come out, you grab it, you clean it in the water quickly, and you put it as soon as possible and reach for dental help as soon as possible.
Great. So you got that, all you sports kids out there. If your tooth falls out, rinse it off real quick and pop it back in. Exactly. And then go see your dentist. We're going to take a quick break, and we're going to come back with some more about dental implants to make that smile look great.
And shine.
And shiny.
Are you looking to simplify, focus, and live a healthier, balanced lifestyle? Hi, I'm Jane Robinson, certified health coach and founder of Jane Robinson Creative Living Solutions. I can help you create a personalized, holistic plan through natural living, creative space solutions, and through a system of Nourish and Glow essential oils. I can guide and inspire you to create an authentic life full of vitality and joy. Contact me, Jane Robinson, Creative Living Solutions, at 561-305-2317. That's 561-305-2317. Or visit me at janelrobinson.com.
Hi, I'm Mary Ellen Brinker, founder of the Brinker Education Initiative. We provide Hispanic students in South Florida who excel in STEM, science, technology, engineering, and math, financial support to achieve their educational goals. They are the youngest and fastest growing demographic in public schools, and 18 out of the 25 top best jobs in America are STEM-based. Give the gift of a college education at brinkereducationinitiative.org or contact us at 773-717-6828. That's 773-717-6828. When they succeed, we succeed. Our nation succeeds.
Multiple horrifying childhood dental experiences has inspired Dr. Viviana Waich, CEO of Sonrisas Dental Clinic, to become one of the most compassionate dentists in South Florida. So if you're anxious or fearful about going to the dentist, Dr. Waich is the dentist for you. With the latest in technology, Sonrisas specializes in dental, cosmetic, and orthodontic services, including Invisalign, teeth whitening, crowns, veneers, implants, root canals, cleanings, dentures, and fast braces. Call 305-944-0000 or visit sonrisasclinic.com. Surgery make you queasy to think about? After years of being mistaken for someone in her 20s, Alicia Couri, a mom of 3 in her late 40s, finally got tired of hearing, "You should write a book about why you look so young." So that's exactly what she did. In her book, Age Younger, 21 Tips to Make Your 40s Look Like Your 20s, she outlines 21 of her top tips for looking and feeling decades younger. These tips can easily be implemented into your own lifestyle so you too can make your 40s look like your 20s. Go to acradio.live to order your copy today. Hi, I'm Alicia Couri, and you know me from my radio show, Unleash Your Audacious Confidence with Alicia Couri. If you lack confidence and boldness to really go out there and conquer the world, I'm here to share this valuable resource. In my book, Your Signature Style, Unlocking the Confidence, Style, and Influence of the Savvy CEO, I'll take you through a process where you can release your fears and embrace your femininity as a powerful tool to unleash your audacious confidence and win. This is where it all began for me, and I want to share it with you. Get your copy today at acradio.live. Bring out your beauty and confidence from the inside out. Buy this book today at www.acradio.live. You're listening to Unleash Your Audacious Confidence with Alicia Couri. Now, let's get back to the show. We are back live. We are back live. You keep catching me trying to find what's going on Facebook here, because I'm always inviting you guys to watch. So make sure that you're inviting your friends. You're sharing it on Facebook, swiping and sharing on Periscope. Hi to everyone on Periscope. Hi to everyone on Facebook, YouTube that are watching us live here. I have Dr. Viviana Waich with me, and I just wanted to let you know, yes, I have my books, Age Younger and Your Signature Style. Make sure to go to acradio.live to get your copy today. So we were talking all about dental implants. You know, your smile affects your confidence. Your smile, the way you look, it really, because I hated my smile for a long time, my whole life, and I thought my teeth were too big for my face, and that's just a whole lot of stuff. But
now people pay money to get bigger teeth.
Now people pay money to get bigger teeth, so I was ahead of my time.
Exactly.
So if you're missing teeth, or if something is not right with your smile, you're not as confident as Dr. Waich said before, and you're afraid to smile. So we have some solutions. She has some solutions for you with dental implants, and we're explaining the procedure, how it works. And You need to have enough bone, though, in order to put the implant in.
In order to put the implant, you need to have a proper base. And the base we consider after taking the teeth out, you have the bone graft done, immature after 3-4 months, and then you can put the implant.
Okay.
The implant is made by titanium, so most of the patients, they won't reject it. Usually an implant company that it's a proper branding and it has good support and it's not a cheapy implant, it will have the 90% policy that if you lose the implant for any reason, they're going to give you another one. Mm-hmm. And if the second one doesn't work, it's because something else may be wrong systemically, or the patient is a smoker, or it has arthritis or any other medical condition that it doesn't allow to work properly.
Meaning that it gets loose and it comes back out.
Correct. But it's very rare that you reject. For example, if you had a knee surgery or if you get a hip replacement, they are made by titanium, so it's exactly the same protocol, and we learned it from Brandemark, which is one of the initial creators of implant for orthopedics and for other type of system. So you get the implant there. Once the implant is in the mouth, you need to wait another 4 to 6 months for the actual screw to glue to your bone.
Okay.
Okay? Once that's done, then it's when you can put the crown and you make the smiley part. Meanwhile, you're going to have something temporary.
Right.
If it's a front teeth, you're going to have, like you were saying, a partial denture, something that you put it in and put it out.
Right.
It's in the back. You will talk to the patient. We'll see if you really need it or not. For example, I had the last tooth that I missed. I don't need nobody going to see it. Even if I sing opera in a big theater, nobody will see it. So I didn't put anything at that time. But if it's aesthetic, you're definitely going to have to wear something meanwhile. For example, your daughter, she's missing the lateral. She will have to put something temporary so nobody sees that she's missing the tooth.
So how common is it for people to not actually even have that? Because I had never heard of that before until I had my children, and 2 of my 3 children were missing those lateral teeth.
Because before we were doing bridges and crowns, and we didn't push for the implant because we didn't know the technology and it wasn't accessible for everybody.
But how common is it for people to not even have those teeth?
The laterals?
In their bone structure.
There is an order of what the teeth, they have more anomalies in the body. Number 1 are the wisdom teeth. They grow in different shapes in different ways. Mm-hmm. Number 2 are the laterals, which we call the peg lateral. For example, they look like a vampire kind of thing. Or they are missing. The premolars sometimes in the lower jaw are missing. So that's the order. First the wisdom teeth, then the laterals, which are the next ones to the ones in the middle. And then the premolar, which are the small molars that we have in the back of the mouth. Okay. So it's not that uncommon, and the good thing is that you can move teeth with braces and make the spaces for the implant. Before, they used to make the space, and they were going to put a bridge, for example. Yeah. And they have to grind healthy tooth. That's why we are forcing people to go for implant, because we don't want to grind a healthy tooth. That the first step will be the crown. Then after 10 years, you're going to get a root canal. Then it's going to get a new crown. Then you're going to end up taking it out, and then you're going to have an implant.
And then you end up with an implant anyway. Well, that's the thing. Both my girls were treated differently, because the first one, she also didn't have the laterals, and they closed up the space and grind the canines
to look like a
lateral. Right.
That's another option.
Right. And then this one, her mouth is too small, so they had to open up the space to put the implants. And they're going to hate that I'm talking about them right now.
Oh, my God. I'm so sorry. Let's talk about somebody else.
I'm so sorry, but, it's the topic. We're talking about implants. I'm sorry.
Don't worry. We can talk about mine.
You'll have a beautiful smile after all of this dental work, I promise.
Amen for that.
So when you get the implants, you then put the crown on.
Correct. So after the implant, you have a connector between the implant and the final crown, and we call that abutment. This technology are like your watch. There are like very little screws in between, and we get that little top of the tooth. Mm-hmm. So something can put on top, like it will be in a white color. If you are very crazy and you want to go for gold, go for it. But we don't, I think I opened my office about 4 years ago, and I've been working for another 15 years. And I think if I put one gold crown, that's the only one. Nobody wants to go for gold anymore. It's not fashionable anymore.
Okay, good. And you know what? It only lasts for so long. You get tired of this one gold tooth. So yeah,
we have
make
all
a
kind
nice
of
white
things.
smile.
Yeah,
yes,
definitely.
make it a nice white smile. I want to let you know that Sonrisas Clinic is in North Miami Beach, Florida. You can always call their office at
305-944-0000.
305-944-0000 to make your appointment, or just even to call and get a consultation.
We're going to do a free consultation for whoever calls and say that they were in the Alicia Couri show and they were listening. We're definitely going to do a free consultation in implants, Invisalign, and for assessment of a smile design.
A smile design assessment. Okay. So make sure you call her office or go to sonrisasclinic.com and get your free assessment done with Dr. Viviana Waich. She is amazing. And her story, her backstory is that she had a really horrific experience when she was a child. So now she is in dentistry to help other people who have any kind of anxiety going to the dentist to ease them into that process. So
Amen.
If you are scared of going to the dentist and you have those missing or loose teeth because you're afraid to go, she is the dentist for you. I'm telling you, she is amazing. She's my dentist. I highly recommend her, and many people on Facebook also are recommending her. So we gotta go. We're already done. Can you believe it?
Oh
so
my God.
Next week I'll have Tara Hooper. You're gonna want to come and listen to that show. I wish you all have a great week this week, and I will see you again next week. Bye
bye.
Bye everybody.
Thank you.
A wise friend always says to me, we have a finite number of minutes to spend. And just like you can only spend $1 once, you can only spend 1 minute once. It's your choice. So I want to thank you from the bottom of my heart for choosing to spend some of your minutes with me on my show. I wish you love, health, and happiness to live your life with audacious confidence. I love you, and we'll see you next time.
The opinions expressed on the preceding sponsored program were